Hi, everyone. Aaron Groff here with County of Santa Clara Public Health Department. Apologies for the delay. There was a medical emergency here, but very grateful for the quick response of our first responders today. Reason for the delay today. But today here at the Public Health Department, we're going to be discussing updates on the spread of influenza and respiratory viruses, including local data, prevention steps for families, and a new wastewater tool to show levels of flu in the community. Speaking today is Dr. Sarah Rudman, Deputy Health Officer here at the County of Santa Clara Public Health Department, Dr. Vidya Mony, Pediatric Infectious Diseases Specialist and Associate Hospital Epidemiologist at Santa Clara Valley Medical Center. And we're going to have a Spanish remarks from Patricia Serrato, Immunization Program Manager here at the Public Health Department as well. We're going to start off with remarks from Dr. Rudman. Then after Dr. Mony speaks, we'll have some time for a quick Q&A. And then Patricia Serrato will deliver her remarks after that. So first we'll bring in Dr. Rudman.
Great. Thank you, Aaron. So this is the first year where we're not only facing COVID, but also increased influenza activity and unusually high levels of RSV. These are two other types of viruses that can also cause some of the same respiratory symptoms as COVID, but can also cause severe respiratory disease or even life-threatening disease. And while all of these diseases can sometimes cause milder illnesses in most older children or younger adults, they're all especially dangerous for our youngest children, our oldest adult community members, and people with other medical problems. And right now, we are already seeing these diseases hit our youngest children and impact our hospitals and our doctors' offices to get care for these children. So with the holidays approaching, it's especially important we do everything we can to prevent these diseases. For the viruses that do have a vaccine, that means getting vaccinated right now as soon as possible. We have vaccines for influenza, and everyone 6 months and older is eligible and needs to have one every year, so making sure we've got the latest flu shot this year. For COVID, we have the new bivalent COVID boosters, and everyone age 5 years and older is eligible for those. And then our children age 6 months to 5 years should also have already received their primary series against COVID. Now, for RSV, there is no vaccine. We have to rely on what are still incredibly helpful, powerful tools to prevent the spread of RSV. These are things like washing hands, wearing masks when indoors, and keeping sick children away from each other. When we're sick, staying home, keeping kids home from school, even keeping siblings apart from each other, because what can feel like even just a mild cold in an older child or an adult can be life-threatening for young babies. Now, in addition to the concerning reports you're going to hear more about from our hospitals and pediatric doctors' offices, public health is also using cutting-edge science to track these diseases and gauge our response. Today, the Public Health Department is releasing a new tool that will help the public monitor the levels of flu across Santa Clara County. This tool tracks levels of flu in the wastewater to tell us about spread happening right now in Santa Clara County. The tool can be accessed by going to sccphd.org/flu data. That's sccphd.org/FLUDATA. Wastewater analysis is already playing a pivotal role in how we respond to COVID by tracking community spread. It provides us an early warning system long before case rates start to go up or hospitals get inundated, which allows us to let our hospitals and healthcare systems know what they're about to expect. Now we have a similar flu wastewater dashboard available for the public. And people can use it almost like a weather report, where you can look to see what is the activity of flu in my area, in my community, and what do I need to do right now in response. And I'm here to tell you today that right now the wastewater are showing rising levels of flu in every part of our county, in every sewer shed that we monitor. And that means for every community member here in Santa Clara County, it's time to get your flu shot as well as your COVID booster and use every tool you can to prevent these other diseases spreading. So to stress again, now is the time, but it is not too late for these interventions to make a difference. Getting a flu shot, getting up to date on your COVID booster, and using tools like washing hands, wearing masks, keeping sick folks away from healthy ones, especially little babies and our vulnerable community members, to make sure that we curb the spread of these respiratory illnesses, all three of them, across our community. Now, thank you. I'll pass you back to Erin, and I'll be here to take questions at the end.
Thank you, Dr. Rudman. Now going to bring up Dr. Vidya Mony, a pediatric infectious diseases specialist and associate hospital epidemiologist at Santa Clara Valley Medical Center. Dr. Mony.
Good afternoon, everybody. My name is Vidya Mony. I'm a pediatric infectious disease specialist and the associate hospital epidemiologist at Santa Clara Valley Medical Center. I want to thank Dr. Rudman for her thoughtful comments that she just gave right now. But I also think it's really important for everyone to understand what is currently going on within our hospital system. In the past couple of weeks, both in our inpatient and our outpatient settings, we have seen an acute surge of patients, specifically in our inpatient setting, in both our inpatient pediatric ward and pediatric ICU. The predominant cause for these hospitalizations are secondary to respiratory viruses, specifically RSV. As an enterprise healthcare system, we have worked with our care teams and our leaders to expand access and come up with mitigation strategies in order to accommodate this increased surge of patients we are seeing right now. But with this said, we really need your help. We need you to do the things that Dr. Rudman was just saying right now to help us prevent hospitalizations. So I'm urging you today to please get yourself vaccinated against the viruses that we have a vaccine for. I've also seen an uptick in COVID-19 infections in our pediatric patients in the past couple of weeks as well. So please get yourself vaccinated against COVID-19 and also get your influenza shot now. We are seeing an uptick in influenza now, and the rate is slowly rising every single day. And I have no doubt in the next couple of weeks, we're going to be surging in influenza as well. The next thing I would really recommend is continue to wash your hands and frequently. Many of these respiratory viruses are spread through droplet and through contact. And the way to prevent transmission is to just wash your hands. So please remind your family and yourself to frequently wash your hands. And finally, if you are sick or anyone in your family is sick, please stay at home. Don't send your child to daycare or school, and please don't go to work. This is the easiest way to spread the infection to other people and increase the burden on our healthcare systems. We are all in this together, and we have been for the past 3 years. So let's keep each other safe and healthy. Thank you all so much.
Thank you, Dr. Mony. And if there are any hospital-related questions or questions specifically for Dr. Mony, she'll have time for just a couple as she has to get back to her other duties. And so we'll have time for about two questions now if anyone wants to start. That's right, if anyone wants to go first. Yep.
Mm-hmm. Sure. So RSV specifically, so it has not been, we have not seen RSV to this extent in a few years secondary to the pandemic. We've also seen intraseasonal variations of RSV. So in the past couple of years, RSV was more or less surging more in the late summer season, which is an atypical time period. And right now we have seen an abrupt increase in all of our RSV cases. I mean, if you look at a lot of the curves, it's almost linear, especially across the nation and within California and in our health system. So this is significantly more than we have seen in quite a few years right now. We have been expanding capacity specifically in our healthcare system under the guidance of our regulatory and our physician and nursing leaders. So we are doing everything we can specifically in our system to make sure that we can accommodate everyone.
We'll have time for two more questions here.
So I've heard in the way that this flu season has been described is two things, and they sort of dovetail, that maybe this is a stronger strain that's circulating this year, and maybe our bodies and our immune system is less prepared for it because of the protections that we took during the pandemic. Is that an accurate description?
I'm going to attack the latter part of your question first. So our immune system doesn't necessarily just turn off because we're wearing a mask or we're washing our hands. Our immune system is constantly working and fighting off infections on a daily basis. That being said, a lot of these viruses that we were seeing pre-pandemic were in decreased circulation. So if you're not exposed to those viruses, you're not going to get immunity to it. So a lot of the children specifically who were born during the pandemic, or even our younger children, were not exposed to a lot of these viruses, are now seeing it at this time. So with that said, I'm not also sure that I would say that the strain of influenza right now is stronger than before, but it is just surging right now. And that's why it's really important to ensure that we continue to promote vaccination, because we know that it works and it helps prevent hospitalization, specifically in influenza and COVID.
Final question specific to Dr. Mony. If not, we'll let Dr. Rudman carry the rest of the Q&A.
Yeah, are you guys seeing an amoxicillin shortage like the rest of the country is seeing right now?
Yes, we are seeing an amoxicillin suspension shortage. So let me make it clear. It's not within the capsules or the tablets. It is in the liquid suspension for amoxicillin. There is also a back order in the amoxicillin chewable tablets. We have worked with our Pharmacy and Therapeutics Committee to come up with alternate antibiotic regimens to give to our physicians and providers to use in order to prescribe safely and not cause any over prescription of antibiotics. Thank you for that question. That's really important.
Dr. Mony, thank you so much for joining us.
Thank
here
you.
today.
Thank you all so much. Appreciate it.
We'll have Dr. Rudman come up and to handle the rest of the Q&A. Happy to start going left to right, right to left. Who wants to jump in here? Any questions? Yep.
The flu vaccine, right? They're kind of projecting or trying to guess what the predominant strains are going to be here. In terms of the strains that are coming into hospitals versus what could be immunized for, how well are those matching?
I think we don't know yet how well we're going to see a match between the current flu vaccine and the specific strains of flu that are circulating right now and that are going to be circulating throughout the winter. What's fortunate, though, is that every type of flu vaccine, even when there's a so-called mismatch between what's circulating and what's in the vaccine, provides a level of protection. Just as we've seen where new variants of COVID have hit us and the people who were vaccinated still have protection from the old vaccine and even better from this newer bivalent booster, we see the immune system able to protect against the more serious consequences like severe disease and death, even when there's an imperfect mismatch of the vaccine. So we still feel confident that the most important thing people are going to do this year is to get their flu vaccine and get their Omicron booster for COVID, even if it turns out this isn't a perfect match year between our flu strains that are circulating and what's in the vaccine.
One quick follow-up.
Yeah.
So we are obviously bumping up against Thanksgiving. What, besides getting your shot perhaps ahead of those gatherings, what other advice if people are really trying to stay?
One of our hopes of making sure that the public have access to the same cutting edge data that the public health department has by publicizing this flu dashboard is that people can look themselves at the COVID wastewater and the flu wastewater data and say, how much risk am I at right now? And what does that mean for myself and my family? And so while we strongly encourage everyone to get their flu vaccine now if they haven't already, and get their COVID bivalent booster now if they haven't already, watching those wastewater data can help people understand if they need to take additional layers of protection, like continuing to wear masks indoors, or potentially even changing plans for gatherings if there were plans to get together with particularly medically vulnerable family members, young babies, older adults, or to gather in large groups indoors. Families may decide that this is not yet the year to have that large family indoor gathering if they're especially vulnerable folks, or if we continue to see this scary trend of high rates.
Next question here. One more question from the group.
I guess I was trying to ask perhaps for the doctor, just about the hospitalizations, what we're seeing around the county. I spoke to my doctor about this, and they said that there's a lot of kids in the hospital on oxygen, but it's not like they're on ventilators, they just need oxygen to kind of get through this and get it out. What sort of things overall are you seeing in hospitals across the county on severity?
One of the things that's tricky about all three of these diseases, RSV, influenza, and COVID, but especially about RSV, is it can run the complete gamut from a very mild cold-like illness to a true life-threatening illness that, as we saw just recently, caused its first death across California in a young child. So we are in that setting seeing every range of disease, from kids who are just sick enough to be home from school or daycare for a good amount of time, to those who may need new treatments like an inhaler or careful monitoring in the hospital, some who may need oxygen, and some who may be sick enough to be in the ICU, as Dr. Mony was describing.
That's it, Dr. Rudman. Thank you, and we'll bring
Thank
in
you.
Patricia Serrato, our Immunization Program Manager, for remarks in Spanish now. Thank you.
Buenos días. Esta mañana el Departamento de Salud Pública del Condado de Santa Clara quiere compartir con todos ustedes información importante acerca de una nueva herramienta que estamos utilizando para prevenir y rastrear enfermedades como el COVID-19, la gripe y también el VRS, que es el virus respiratorio sincitial. Esta herramienta es el tablero de control de las aguas residuales para la gripe. Actualmente, los datos muestran que se ha triplicado el porcentaje semanal de visitas a las emergencias por enfermedades similares a la influenza. Esto lo estamos comparando con los datos de la temporada de influenza del 2019-2020, que justo fue antes de la pandemia del COVID-19. Además, estamos observando que no solamente existe una mayor actividad de la gripe y COVID, sino también que existen niveles inusualmente altos del virus, el VRS. Esta es una enfermedad respiratoria que afecta principalmente a los niños pequeños y que, por supuesto, está impactando los hospitales y las clínicas o consultorios médicos que están atendiendo a estas familias. Con la llegada de las celebraciones del fin de año, es importante redoblar nuestros esfuerzos para prevenir estas enfermedades. Y es por eso que les estamos animando a todos a que se reciban las vacunas para todas esas enfermedades que existen vacunas, como en este caso es el COVID-19 y también la gripe. Entonces, también queremos recordar que está el refuerzo Omicron disponible para niños desde los 5 años y para personas en adelante. No hay vacuna para el VRS, pero están siempre los cuidados o las recomendaciones que ya hemos hablado anteriormente, que son, por ejemplo, lavarse las manos frecuentemente, cubrirse su boca si está tosiendo o está estornudando, y también quedarse en casa si está enfermo. Y eso es principalmente importante para los papás o las personas que cuidan niños menores de 2 años o recién nacidos. El Departamento de Salud Pública está utilizando ciencia de vanguardia para rastrear y responder a estas enfermedades. Es por eso que hoy estamos anunciando la utilización de una nueva herramienta para que el público pueda monitorear por ellos mismos el nivel de la gripe en sus comunidades dentro del Condado de Santa Clara. Esta herramienta se ha empleado de una manera importante en la predicción y el rastreo de transmisión comunitaria para el COVID-19. Fue bien importante durante la pandemia. El análisis de las aguas residuales nos brinda una indicación temprana de un riesgo comunitario. Esta información nos ha ayudado a alertar a los sistemas de salud y a los hospitales cuando hay un posible aumento en el número de casos o en el número de pacientes. El tablero de control de las aguas residuales contra la gripe es uno de los primeros en su tipo, y el Condado de Santa Clara, el Departamento de Salud del Condado de Santa Clara, es uno de los primeros en el país en utilizarlo. Esta herramienta es pública, y lo que significa que todas las personas pueden ir a nuestra página electrónica y consultarla. Por ejemplo, si usted revisa el tablero y observa que hay un número de casos de gripe en su área aumentado, eso significa que probablemente el riesgo en la comunidad es mayor. Los niveles del virus y transmisión pueden variar mucho en diferentes partes del condado. Actualmente los datos muestran que los niveles de influenza A obtenidas en las cuencas del alcantarillado está por encima de los obtenidos en fines de octubre. Eso significa que los números de casos desde octubre a noviembre han aumentado. Y también han encontrado otro número aumentado, principalmente en áreas en Gilroy y también en Palo Alto. Nuevamente resaltamos que la mejor manera de prevenir la gripe y prevenir complicaciones es vacunándose, y el tomar las medidas preventivas nos ayudará a mantenerlos saludables a nosotros mismos y a toda nuestra familia. Gracias.
All right, thank you all for joining us here today.